So, hi guys. I'm very happy to be here. It's really a pleasure to see so many MBST fans and that are going to be one after that. First of all, I have to thank Liz and Jamie and Charles. Thank you for this great event. Thank you for the good vibrations that I feel in that room. It's perfect, very, very well done. Thanks for the technique, and thank my previous speaker, Charles, for doing the theory part, because this is for me. To explain this is horror, so thank you very much. Now we can go to that thing that I do. We can have a look on the impact of MBST on sports medicine and do practical things. Okay. First of all, I have to introduce myself a little bit, very short. I used to be a general practicer over now more than 15 years and doing sports medicine at the same time nearly. And I used to be the team doctor of FC Augsburg. It's the first Bundesliga team in Germany. They went up the year I came in, and now they're staying in the Bundesliga first Bundesliga for 12, 13 years now. I quit it about 5 years ago because I wanted to open up a second practice. MedWorks is my second practice. The first is only for general medicine, and the second one is only sports medicine, rehabilitation medicine. Yeah, and it popped up like a startup, really, really fast-growing startup now. And I think this is what is my passion, and that's why I do this. What is the essence of modern sports medicine and rehabilitation medicine for me and my team is always regenerative medicine. We want to heal. It is not to put cortisone on it and to say one day later, oh, perfect, I did a good job, and 3 or 4 days later, it's all done, all gone. We want to stop degenerative processes. We want to get the control of our homeostasis back. Oh, I have to pre-apologize for English is not my first language, so I have to pre-apologize not for me, but for my English teachers. So I assure you, they really tried everything, but sometimes you fail in your life. And regenerative medicine is, we deal with the restoration of dysfunctional cells and tissues. We want to give the body the possibility back to heal itself. That's it. Healing mechanisms in the body are strong in every person, strong in every age. And you can do a lot. It doesn't matter if it's a 3-year-old child or a 93-year-old woman or something. It doesn't matter. You can always put help to the healing mechanisms in your body. And that's what we believe, and that's why we are so successful the last years, I would say. We are doing a lot of different things. MBST is not the only one that brings health back, but we're doing a lot of things. We're doing hyperbaric CO2 cryotherapy. We are doing shockwave therapy a lot. We're doing laser and BCS. It's a kind of blood therapy that we use, and a lot of things like training therapy on the Alta G, for example. Phytopharmaceuticals, is it right? Phytopharmaceuticals, do you know what I mean? Yeah, perfect. Kinesiotaping, chiropractic. We are doing a lot of things, but you see in the middle of all reach a very high level in our concept is MBST, and I will tell you why this is such a great part of our combination therapy, because it is pain-free, it is non-invasive, it is easy to use, so easy to combine. That's always something that I tell the physiotherapists, because if you talk to the physios, it's always like, I'm doing all the stuff with my hands. Yes, of course, do it. You're great in that. But do it also with this, so it gets better. You don't have to do something. Put them into the MBST and do your stuff as you did it before. And the results will be better. So easy. You have no side effects. It's anti-inflammatory. It's regenerative. We do it even directly after surgery. They come out of the hospital and we start. We'll see that afterwards. And there's no tissue irritation. That's very important for me. So, yeah. The most important things for me are cases. Charles already spoke about that it's very necessary to have studies. Of course, it's very necessary to have studies. But in my opinion, studies are good, but you have, as a practitioner, you have to see it, you have to feel it, you have to see the emotion that comes up when the patient, after 4 or 5 treatments, says, I feel something, it's getting better. I didn't have this feeling for 3 years now. that's what for us is important, not what all the studies say. Yeah, it's good to have evidence-based medicine, it's perfect, but not always. And to know in absolutely every detail how it works is not important for me. And I hope it's not so important for all the practitioners in here. Because I think if you wait until everything is known about this, you can wait the next 10 or 15 years, I don't know. There are so many people or so many patients you can treat in that time. Yeah, that's a loss of time. Okay, let's start with a avulsion fracture at the anterior inferior iliac spine of a 14-year-old very, very talented tennis player. Now he's 16 now, sorry. Good, yeah. He had in a warm-up before the tennis training, he had got a check from the side when they were playing football, and he had acute stinging pain. It was really, really bad. Then they thought, okay, it must be some kind of muscle tear or muscle fiber tear. And they did physiotherapy, cooling therapy, and so on, and said, wait a little bit and start moving again, and then this will go away. It's just a muscle fiber tear. After 14 days or 13 days, they did an MRI because it said it isn't getting better at all. And they saw this fresh avulsion fracture at the iliac spine, a gap of 6 to 7 millimeters. That's not something you have to operate, but it's a severe injury and a little retraction of the biceps femoris muscle. And when he came to me, that was 11 days later, he still had very strong pain when I put pressure on it. He couldn't, the contraction pain, he couldn't stretch his knee, the hip flexors, because the muscle was so hard, couldn't work properly. He had a range of 15 degrees in the hip. That's not much. And it was really a severe situation for him because he was very ambitious. He told me when he came, I asked him, I'll show you, there it is. I asked him what he wants, and he said, I want to play the German Masters in 7 weeks. And I said, okay, that's a little bit demanding, but I like these ambitious guys because they do what you tell them. And so we started to write from that day on. We started with a combination of MBST, the laser, shockwave, cryolite. You will see some of these combinations in all the cases. And it was very impressive because at the beginning he had in rest a pain of 2 to 3 visual analog scale. Moving was really bad, 6 to 7. And then we try to get them, when the pain goes down, and we tell them your pain will go down. It was not so easy because he had the pain for 4 weeks. Then we tried to get you into move as fast as possible. But he understood, okay, if I want to play there in 6 to 7 weeks, it's not possible not to move early. So he had an athletic trainer, his own athletic trainer, very, very good. And what I want to show you, of course I can tell you what he did every step, and that gets better and so on, but a very clear, for me, a very clear sign how much better it gets is how much pressure can I put on with a shockwave. Because the shockwave is painful. And if you see here, the lowest pressure that I have is 1.0 bar. He started with 1.3 bar at the first day we did MBST. We did it the same day. And then it was like, oh, this is really painful. And it was like nearly crying. The second, after 2 days later, after the second MBST was 1.9. The third and the fourth was 3.0 bar. Nobody in this room wants 3.0 bar at this part of his body. It's really painful, but it was no problem for him. And after 7 treatments, we were at 3.5 bar, and the guy could do nearly everything. So, in my opinion, it's always very necessary to get to full load of the training and doing coordination, sprints, strength training before 1 week before you get back to competition. The return to competition must have 1 week, at least 1 week before, with the full training load. If this is possible, yeah, you can try to get back to competition. And yeah, we did this. He played the German Youth Masters in Essen. He had not such a good draw, so I think he lost in the quarterfinal, what was terrible for him. But the next 3 under 16 international tournaments he won in a row and had no complaints at all. And he doesn't have any complaints until today. And that was really a fast recovery. I had a discussion with a doctor who's at Bayern Munich, and he's the doctor of the under 23 23, under 21, under 19, 18, 17, 16. And he had exactly the same case, and he needed 5 months to get him back because they don't have MBST or something. And 5 months to 6.5 weeks, there's a difference. And here we did the MRI at the same day that he started the full load training. And it was a completely healed abortion, no longer detectable. That was really impressive. And you can see it, I can show you. This white thing is a vessel. Here you can see. You see a very little bone marrow edema still, of course. I'm not a magician. But to compare it with this and see that he plays such interment, it was great. I think, completely underestimated topic is muscle injuries with MBST, because it works so perfectly and you can combine it with all the other things, physiotherapy, shockwave, whatever we do. And I have an example from the last 5 months. He's a first Bundesliga football player, was playing for Stuttgart, had a severe injury, a semimembranosus complete muscle tear. His medical history had middle foot fracture, low back pain for a time, and an LCL rupture on the same leg. So I think it could be that he was not trained well enough, and that's why he got the hamstring problem, because it was, as we know, the hamstring problems in a fast run in a duel with a contender, and he did a long step and then the semimembranosus muscle was not there anymore. The problem was that there at the first MRI they thought he has only a muscle fiber tear, a bigger one, but only a muscle fiber tear. And so the treatment was only rise, physio, stimulation current, try to increase the load as fast as possible. And after 6 weeks, when they wanted to get him back into the team training, he had a feeling like, no, that's absolutely not good for me. And they did another MRI, and then they saw that the semimembranosus was really complete ruptured. And we did the same. That day he came to me, and we did an MRI with our specialist. I have to introduce Dr. Mundinger, because he's one of the best MRI specialists concerning muscle problems I think in whole Germany. He worked together for 30 years with Dr. Müller-Wohlfahrt. And what he says and what he finds out about muscles is unbelievable for me, clearly. And we decided, together with the athlete, together with him and the manager, there's no need to operate this anymore. It's 6 weeks. The injury is more than 6 weeks old. The injured muscle was in a very good position directly. Stick to the semitendinosus muscle, and surgery will be a very big new trauma, and the re-injury rate after 6 weeks will be very high. So now we try it in a conservative way. These are the pictures of the MRI that we did. You see the distal part, the proximal part, and the gap in the middle. It's really a severe, here you see it better. It's really a severe muscle injury, but it comes to a good place where it is here to the semitendinosus muscle. And so what were the goals of the therapy? The healing of the semimembranosus muscle to the semitendinosus muscle must be the first and most important topic, because we want to have this muscle in a position that it can do its work again and use the semitendinosus muscle and the tendon to deliver the same strength afterwards. The problem is that you have the missing tendon of the semimembranosus, so it's not the same direction that the muscle goes, and that's the problem. When you strengthen the muscle, you will have the semitendinosus muscle stronger than normal, which is not good, because then the re-injury rate gets up. I will show you that, because we have EMG images, and we want to have the scarring away, because if you get a very big scar, if you wait too long now, it's 6 weeks, so if you wait longer, you get a very big scar in there, and that's the next problem for re-injury. So what did we do? We started the same sessions. We did, in this case, 2 times the blood cell secretome. It's a kind of on blood therapy. We did 2 injections in the part where he had the most pain. He had still pain in a part for more than 6 weeks now. And all the other things around, so enzyme combination therapy, there's bromelain, trypsin, and rituximab in it. In Germany, we call that ROP enzyme. Omega-3 fatty acids, vitamin D3. In the muscle injuries, I think this is very important because we have receptors in the muscle where the vitamin D are occupied by the vitamin D normally. If you have normal muscle function, if you have not enough vitamin D, it's bad for the muscle, makes muscle soreness, pain in the muscle, and contraction. And that's why we use it in a higher dose. And PhytoShake is something that combines phytopharmaceuticals like curcuma, boswellia, also bromelain, and anthocyanins from the blueberries, and resveratrol from grapes. Together, unbelievable anti-inflammatory, better than any NSAID that you can give, but no side effects. That's why I combine this normally too. Then, of course, as early as possible, get him back into the movement and increase the load with a professional athletic trainer step by step. To show you what I have a study that shows you what problem you have if you start late in your therapy. This shows from Bayer in the group around Bayer, New England Journal from 2017. It's amateur athletes, of course, not professional athletes, but it shows if you start the physiotherapy and the training 2 days after the injury, you get them back on the field for their sports on 62 days. If you start 1 week later, 9 days after that, you get them back after 83 days. That's 3 weeks later. And we started the whole therapy 6 weeks later. So, yeah, not the best start. This is a measurement, EMG measurement from Simon Roth. He's the best guy you can get for EMG measurements in Germany. He's doing his job in Mainz, but he's been everywhere in the world. I think he's been to Liverpool, and all the Bundesliga teams come to him. He measured out that now, after that injury, you have a very, very strong, where is it? Yeah, the gluteus muscle, for example, that's the gluteus medius. On the right side was had no real strength anymore. The hamstrings, the semitendinosus muscle, came up much too much. So you see normally, where is it? Biceps, semitendinosus. Normally this should be much lower. The semitendinosus muscle got stronger and stronger because it tried to fix the whole thing without the semimembranosus, and that's the problem. So he gave him, here you can see there, yeah, that's the right side, semitendinosus, that's the left side. That should be, that one is at the moment. And the glutes have a balance of 35% to the other side. That's horrible, because if you go on like this, he will have one injury after the other. And the second MRI and the treatment showed much better fibrosis plate than we had here. We wanted this to stick to the semitendinosus, and there you can see it here on the left two images, and the right two images are 17 days later. I think that is really impressive how good it got, and the reparative processes you can see on the right side. The clinical cause was after 3 days he was pain-free in his all-day activities. After 6 days he was pain-free in maximum contraction. That was the biggest problem on two smaller parts. He couldn't get into the whole contraction because of the pain. So the cycling was no problem anymore, and he began jogging. We tried to do this on the Alta Chi. It's to get, do you know Alta Chi? Yeah, it's a treadmill where you can get the weight of the athlete away. We started with this, but it was no problem after a few days. And after 15 days, when we did the EMG, he was back to running speed of 75%. So he was really good in his course, but the EMG showed us, okay, be careful. Then he got another training program, and the running speed increased to 90%. He had quick changes in direction, 90% after 23 days. And the return to his full sport-specific training was after 5 weeks. I think this is really a good time for such a bad injury, especially when you look at the time when we started. In this special case, we gave him 2 weeks of full load, and after 2 weeks, we brought him back to the court, means back to the pitch. The MRI, after 48 days, said consolidation of the myotendinous injury. There's only residual scarring of the tendon, what we wanted to achieve, and no bigger other problems in that time. But the most important thing for me was the EMG. And the EMG showed that it was much better. The problem was that he had a severe muscle soreness because he had a very, very strong training week before. And because of the muscle soreness, he couldn't reach the highest points that we wanted. But all the other things, the balance that came back from the glutes was really perfect. As my colleague Simon Roth said, achieved and would certainly have been completely within the expected range for professional athletes. So he said, okay, that's normal for a professional athlete with a muscle soreness. We can give him free for playing in the Bundesliga. So it was the return to competition. And this is the last one from June. And I think this is really a good result. He's back in the Bundesliga. He's now playing because the contract ran out, and they said with this injury they don't want him. But then we tested him in one other club, and now he's playing for at the moment the leader of the second Bundesliga, and I think he will go his way. And there we can see the difference. That was at the 15th of May, as I said. The semitendinosus was doing much too much, and now it came back from 395 to 97. And here the semitendinosus is the same, from 895. It's different kinds of contraction that they do with this muscle to 254, and the glutes balance was 74. But always regard the muscle soreness. So also a great result. Now this is not a professional, that's me. I didn't think that it's possible in my age, when this happened, I was 45, to have such a muscle injury in that age, because I do sports, but not so much that you can have such things, but it was really a bad injury of the gluteus medius. I did a bad movement when I gave training to my 10-year-old son and his team, and immediately in that moment that this happened, it was like I had no control over my body. I fell down, couldn't walk anymore. I will show you in a video how this looks. On the left side, I think everybody can see that there's a lot of blood that shouldn't be there. You can see there. So it was a severe myofascial injury. A massive pain, and I had a Trendelenburg gait pattern. Do you know that? If someone steps, he has no control and no stabilization. That's what I had the first day. I couldn't walk at all, and then we did from the first day on, from the second day on. The first day when it happened, I got the MRI, and the next morning, the first day when it happened, it was only cooling. I sat in a pool with very cold water for about an hour because it was so painful. And then we started the next day after the MRI, MBST, high power laser, everything that I have in my practice, because I said I have to come back. I can't be missing in the practice. It's not possible. I didn't miss one day. It was Sunday, and on Sunday, the first day, I let the video go because I tell in German what happened and so on. I tell you, on the first evening, it was not possible lying on the right side to get my left leg only 1 millimeter high. It was not possible, absolutely not, because of the pain. I couldn't get a contraction to the muscle. And this is 3 days later, after 3 MBST sessions and 3 shockwave sessions. Talk faster. Yeah. And he could walk without any problem. And I work, this is while lunch break.
Ist auch wieder möglich.
Okay, I don't walk very fluent, but I walk. And this is 2 days later, the 15th. And as I said before, the pressure that I can put on with shockwave is, for me, a very good sign how far we are with the healing and get the hematoma out and so on. And you see this, it was possible to give 4 bar 3 days later. 4 bar in such, it's the first 1.6 bar was like, oh, okay, and the 4 bar was like, okay, feel a little pain. Even with an applicator with 20 millimeters, that's really painful. Normally was no problem, and that's unbelievable. I haven't seen. I'm doing shockwave really for more than 9 years now. We are doing 150 treatments per week. I think nobody in Germany does so many shockwave treatments that we do, and I haven't seen this before. Such an increase of the working pressure. I've never seen this before when I didn't have MBST.
Entwickelt sich ganz gut, wie man sieht.
Yeah.
Am Sonntag passiert, haben jetzt
5 days before I couldn't walk because I had no stability there. Look at this.
Eigentlich schmerzfrei so ziemlich alles machen. Laufen sowieso. Gut.
Okay, that's just to see
Also Tag
what's
6,
possible.
heute erster Tag.
Next day.
Große Behandlung, einen Tag Pause. Weil zu viel
Okay,
zu
that's
tun.
my good leg now, just to show what.
Das ist die betroffene Seite.
Yeah. That's what I can do with this side, and now how I can
Auf
stabilize
der
this
Seite
side.
stabilisieren geht auch schon.
Okay.
Und laufen.
And I was surprised of the result, of course, so I tried every day another thing.
Nahezu normal.
You see, it was Christmas. Then after 7 days was the same day when I ran up the stairs. I did. They had a tournament, or under 10-year-old boys, and I said, let's try what I can do with the ball. Even this was possible. Wait, the next one. And the last test that I needed was 10 days after the injury. And yeah, that's something that, as Johnny Nelson said, and I'm very happy to have him heard and seen here, because I've seen a lot of fights of him. I know he's very emotional and very a lot of passion in him. And I saw the passion here when he was talking about that. Now you can understand why the passion in me is very, very high, because this is unbelievable. I had the same with the prolapse that I had in 6 days. I was from to going hiking with my 3-year-old boy in a backpack. It is sometimes really unbelievable, but it works. And these are the cases to show. Here you can see how it developed. Of course, there's still a hematoma. It's not a problem, but Dr. Munninger, very, very experienced in muscle, said, considering the severe muscle injury at the beginning, an exceptionally rapid improvement can be documented over the past 11 days. 11 days. And it didn't have any one day that I couldn't work. Yeah, okay. These are both the new one, the older one. And you can see that the structure comes back. Hematoma gets less, and there is much more structure on the right side. Bone bruises, bone marrow edemas. To come back to professional athletes, this is really a problem, because it's a well paid, but it's also a hard job that they have. The next one they have is he's the captain of the under 21 national team in Germany. Very, very nice guy, great football player. Very hard-working football player, because he's playing at the position of number 6, and he got a real bad hit to the heel at the 14th of September. Massive pain. He couldn't walk anymore. When he was stepping on his foot, he had pain between 8 and he said 10. I put in 8, and in the air walker, he had a pain of 4. I think that's a lot. When we started the treatment 5 days later, that was 5 days after it happened, and he cooled down and everything, but the pain was still there. So when his manager called me, I said, okay, I have a bone session card for the MBST. Let's start immediately. He came and we started and treated him for 19 days. The first treatment at the first MBST was with the shockwave 1.5 bar, the focused one intensity 2. That's not so much because it was very painful. Here you can see the bone marrow edema. It's very, I think this is really severe, and it comes from a hit. So, and you see a little bit here the inflammation of the tendon, not so much, but of course there's a hematoma also around the Achilles tendon. And then after 3 days, it was like he came in. It was funny because he came with crutches and the walker at the first day. And on the third day, he came in like this and said, "Where can I put them?" And I said, "In your car." And he said, "Really? Can I?" And I said, "Do you have any pain?" And he said, "No. It's absolutely fabulous. I have no pain." And he didn't have the air walker anymore. He put it away at home. And we were with the shockwave at 2.7 bar and intensity 7, the focused one. After 5 days, walking around was completely pain-free on the normal heel. So he started running. He could increase the training load unbelievably fast. It was really unbelievable for me too. And the end of the treatment, after 9 days, was the 28th of September. Then I said, "Okay, you're unbelievable fast. It's unbelievable how you can perform now." I spoke to the athletic trainer and he said, "He can do everything. This guy can do everything." And then I said, "Okay, when you go back to Cologne, please give you about 10 days and do everything, full training, everything." He said, "I did my full training and I did more than we normally do the last days." And I said, "No, please, 7 to 10 days, try everything. If the pain is coming back, come again, but don't play in these days." Then the day, the 3rd of October, I wrote him how it is, and he said, "Perfect, no complaints." And then I said, "Okay, so about 5 to 7 days, okay?" And he said, "We will see." It was a WhatsApp. "We will see, ... And in the evening, I had a bad feeling, and I said, "Oh, Mama, Cologne is playing. Let me see." He was playing from the beginning on. And then after that, I sent him a very, such a face at WhatsApp, and then he said, I'm very sorry, doc, but it was great." And from this day on, he had no problems, no complaints anymore, and he played all the season games. He played 6 times for the under-21 national team, 90 minutes. He was never substituted, was really good. On the 15th of October, he didn't want to do an MRI, but his manager and I wanted, and it was a complete regression and a complete healing of the interspongious fracture. Now, one very, for me, very exciting case, because it was my first one with such a fracture of the calcaneus. It was a female triathlete, very professional. She was 25 years old, had the beginning of the pain was without any trauma, and beginning of March 2020. There was a pain in the right ankle. She couldn't say where it comes from. She had a talus fracture 2017, but she said this is more painful than the talus fracture was, and she couldn't explain it to herself. In May, she came to me. It was now 10 weeks later. Oh, I didn't translate this. Means she walked like this. She had a really severe pressure pain when I put pressure on it. And the right ankle, visual analytic scale, if she gives weight on, also on 8 after 10 weeks, really unbelievable for me. And she had, as previous therapies, physiotherapy, rest, cooling therapy, current stimulation, current, magnetic field therapy. That was interesting. And of course, NSAIDs and a plaster, no improvement over 10 weeks. And she didn't want to take, in Germany it's common that in these cases, after a few weeks, they give bisphosphonates. I think everybody knows what it is. But I hate them. I hate the side effects, and in my practice, nobody gets them. And she said that they wanted to give it to her, and I told her the side effects, and then she said, "Never, I will never take this." And I said, "Okay, that's a good idea." But we couldn't also do shockwave because it was too painful. And then I said, "Okay, then let's start MBST. It's not painful. Let's do a little bit laser also, vitamin D3 and so on. keep the air walker for a few days. And we have the very strong cooling, stabilizing compression bandages, and then try to walk after a few days. We started at the 15th of June for 9 days with 1 day break. At the 26th of June, she was slowly walking pain-free after 10 weeks with such a pain. Then she got on a hiking tour 4 days later, pain-free. She started jogging 1 week later. And you can see how it goes. Then she was on holiday, did several beach runs without any problems, did complete strength training where the full weight is on the feet. And then she increased the load more and more, and she went back to competition in August. So we didn't need more than 7.5 weeks for this. And this is such a hugging thing. She came back and said, "It's unbelievable. What did we do?" And I said, "Yeah, MBST, the laser and so on." But I didn't feel that. And I said, "Now you feel it." Yeah, that was the second hugging. Okay. There's the picture for this. That was before here. And this was after. This is a little bit later because I had to talk to her more than 3 or 4 times to do that, because she said, I don't need it. That's a loss of time. But then I put her in here.
Shockwave when she was able to take it?
That was the problem, because she's not from my town. So she went away, and I told her, find someone there to do shockwave too. But she said, it's so good, I don't need anything more. But that's why this is such a great example for that. Yeah, but normally, yes, I would have done. Yeah. This is a friend of mine. He had a complete avulsion or rupture of the hamstring tendon next to me. We played football. Old men are playing football. He's 38. He's much younger than I am, but it was really horrible. He was in the air, jumping when you heard it, and then he fell down. This guy is like this, and yeah, really terrible injury. You see, this is the insertion. You can see that the muscle is down here somewhere, but a rest of the tendon, a small rest of the tendon was here. So it was only here. If this little bit of 1 or 2 millimeters would have ruptured too, it would have been here. It was not possible to fix this conservative. I think it wouldn't have been possible. Matthias has another example from himself. But always in this case, I get the people to Dr. Oliver Hermann. He's a really great surgeon in Augsburg, the chief of the Hessing Clinic, very well-known clinic in Augsburg. And he did the surgery at July the 26th. 5 days later, he was discharged from the hospital, and we started immediately the same day, MBST, shockwave, and the same things. After now 10 days, he could put full load on it. And this is the funny thing I have to show you. Wait. This is what my friend, Dr. Hermann, said he should do. Keep it into an orthesis for 6 weeks with a flexion and extension of 20 degrees, 6 weeks. And only 20 kilograms on it. And after 6 weeks, slowly starting doing more. 6 weeks. Oh, I translated it. Good. So, this was after 2 weeks when he put out the stitches, the end of MBST treatment. He was good, he had no pain. And this is, I let him talk, he's talking about what we did and so on. And this is exactly 3 weeks after the operation, 4 weeks after the injury. Remember, 6 weeks. And then starting to increase the load a little bit. Okay, same.
Ja, es ist genau heute vor 4 Wochen passiert, ziemlich genau die Uhrzeit. Heute vor 3 Wochen bin ich operiert worden.
3 weeks before operation,
ja,
that's what he said.
Jetzt seit letzter Woche, wie vereinbart,
Since last week,
habe ich
full
zum
load.
ersten Mal letzten Donnerstag nach 15 Tagen das Bein wieder voll belastet. Der Chirurg sieht das Video, glaube ich, nicht. Zumindest
Now he says he hopes that the surgeon doesn't see the video.
Und ja, ich bin sehr zufrieden. Ich habe seit 2 Wochen keine Schmerzen mehr.
No pain at all.
Ich kann alles machen. Ich mache
Can
die
do
Übungen
everything.
jeden Tag zu Hause. Also das Anwinkeln, dann das mit Gewicht und so weiter. Und ja, ich glaube, wir kommen sehr gut voran. Was haben wir gemacht? Gleich nach der OP.
Now he tells about MBST,
eine Woche lang, 7
shockwave.
Sitzungen, einmal die ganze Karte und Stoßwelle natürlich. 7, 8 Mal Stoßwelle, Kälte und ja, das
Yeah, that's
Ergebnis
it.
kann sich, glaube ich, nach 21 Tagen
3
sehen
weeks.
lassen, oder? Was meinst du?
So, normally if you talk to surgeons or orthopedics, they always say it needs 6 weeks to heal anything. And you can't do anything before 6 weeks. This is one example of, I don't know how many I have. And the healing process is not depending on time, it is depending on what you do for the healing process. That's my opinion. And with this, I think I can prove it. Then after 5 weeks, he started cycling. In this case, it was really also very emotional because he had a startup 2 weeks before the injury they began. They are dealing with olive oil and such things, and he has to carry a lot. And it would be a catastrophe for him. And he was his only worker, and it would have been a catastrophe for him to stop this because it would have been the end of the startup. And he was out for 1 week. That was all. 1 week. After 1 week, he started to carry. That was the MRI after 5 weeks. Clear regressing hematoma, no retraction of the affected muscle, all muscles where they should be. This was 7 weeks later when he when he brought us some olive oil. I said, let me see your size. And for me, it was very important to show that after 7 weeks there was nearly no muscle loss compared to the opposite side. After 6 weeks like this, it would have been from this to this, and this guy is really muscles. After 10 weeks, he was at a running speed of 80%. Could do all the hamstring exercises in full load that he did before. After 12 weeks, he did a long-distance walk. He's doing this 2 times a year. He's really crazy. 55 kilometers without a break, no problems. And after 20 weeks, after 5 months, not complete 5 months, 20 weeks, he played football again. No complaints. He was playing on. And my last case that I want to show is also the combination of a good surgery and the conservative therapy that we do. This is also a friend of mine, also injured in a football game next to me. It was not I didn't have something to do with this, but it was like a pang on the pitch, and then he fell over, and everybody knew, oh, that's a severe injury, and the tendon was gone. He played football in former times in the 3rd league, so he was well trained because he's also a cyclist and really and a hiking specialist. He's doing really hard things, about 200 kilometers on the bike, up and down and so on. And you can't get him off the bike. That's on the one hand it's horrible for him, but on the other hand it's good for the patient and for my therapy. He had this complete Achilles tendon rupture in June. The same operator that did this, the same surgeon. Then the first treatment took place 9 days after the surgery. Also MBST with a tendon card. The first shock wave was by 2.1 bar on the tendon. You can see after 16 days how it works, and you will see videos now. Because he's always on the bicycle, and that's how he increased the load then. The 4th shockwave treatment, about 3 weeks later, showed 4.0 bar on this operated tendon. No problems anymore. And here he is always having music in his background. I don't know why. But here you can see what he did after 19 days. It's a special shoe that he created, with taping it and so on. He was very stabilized in that shoe, just to sit on the bike. I think this is the most impressive thing after 29 days. It's doing this with a ruptured and refixed Achilles tendon is really great. And then we had WhatsApp contact. He did all his stuff. He went running and so on. Started jogging at the 14th of August. We did, I think we did Shockwave every week then, or every second week. But he said, it's so good, I want to train. Okay, then he sent me WhatsApps. I'm starting jogging now, 5 kilometers, no complaints. Then he was on a hiking tour after 9 weeks with 1,000 meters altitude, no complaints. And then on the 29th of August, he said, he wrote, I am back on my bike exactly 10 weeks after surgery. And I thought, hey, you're back on your bike since the second week after the surgery. But it didn't mean a normal bike. Yeah, that was the moment when I learned that he was a semi-professional cross biker too, something I didn't know. But when he is landing, and after the landing there was no problem, when he's landing, the pressure that you get on that Achilles tendon and the tension that you get on that, if this is possible after 10 weeks, I think nobody has to talk about we cannot improve the healing, we cannot make it faster. Yeah. So the summary for me is, for all of you who haven't had MBST before, MBST works. It works. That's thought. It can be perfectly combined with other therapies, why I said at the beginning, and it supports extremely fast, good and lasting results in professional athletes, not only in professional, but it was my topic to talk about sports medicine, by supporting real regeneration. And I had another patient, semi-professional I would say, and he said, because it is not so cheap, and he said, it doesn't matter if it helps, I do that. And afterwards he said, the money for this therapy is not an expense, but an investment in my health. And that brings it to the point I don't have to say. Sorry?
Amazing, we get all the best parts.
Yeah.
Both sides
Yeah, that's
today, so.
yeah, but it's a pity it's not mine, it's from the patient. Yeah, but that's great. But this is really this very important thing that I want to give all here in this room and all the others outside, and give it back to all your patients. We have something that works. We have something that we know a lot about it. Charles mentioned a lot of things why it works, but we know so many cases. We know so many patients that it worked in their healing process. We have seen Johnny Nelson here. We, Matthias and I and Professor Krapper, and we have seen so many people crying because of the life quality that we gave them back with this therapy or in combination with others. This has to be more widespreading out everywhere. And everyone is needed to get it out, to spread it to all the people, because if the professional athletes do it, if the trainers do it, if the patients, the normal patients do it, if all of you do it, the salesmen of course do it every day, then I think we can start something that started years and years ago and worked for years and years ago, but it has to get a tsunami to help people. Yeah. And so I want to end with the greatest. I don't know what I'm talking about, but the results are good. And the German football legend, he had very good English teachers. I hope we have a discussion now, so I look not back, I look in front. Thank you all very much. Any questions? I hope so. Yeah, you go.
In your last case, since
Yeah.
it was a complete rupture of the
Yeah.
tendon, a lot of regarding the last case where you presented the complete rupture of the Achilles tendon, usually conservative doctors, especially orthopedics, will claim that MBST could not have anything to do with the successful of this. So what do you think, since it was a complete rupture, that was the main effect of MBST in this?
But he got surgery,
situation?
so it was not a conservative therapy of a leg, but this is something, as I said before, I'm not Harry Potter. But if you have a good surgeon and the surgery is done well, the healing process afterwards has to be as strong as possible. And if we start as soon as possible, you get away all the inflammation that you don't want to have post-operative. We get so many growth factors in it. We get so many healing processes started and stronger. And I think this is the most important point. Get it together, because you can't do anything against the gap. Get it together and then give him everything and energy that you can give into the cell. And if the cell works, yeah, it works. Jamie.
Hi, that was great. Thanks for that. One of the main problems we have, everyone keeps talking about getting the message out,
Yeah.
which is, of course, essential, but isn't as straightforward as that. One of the main problems, one of the main barriers that we always come up against is convincing healthcare professionals. Now, far be it from me to say that there is any ego that comes with being a healthcare professional, but a lot of them seem to think that they know better.
Yeah.
So what do you say? What would you say as somebody, as a healthcare professional that deals with this effectively and sees great results?
Yeah.
What would you say to somebody who stubbornly says it's snake oil?
That's a big point, because the ego, in my opinion, is the biggest problem that we have in medicine. Because the doctors all think, I'm God.
Surgeons especially.
Surgeons especially, yeah, that's absolutely right. I stopped telling them all the good stories. And I said to them, I have something that works. I have something that has no side effect. Then the first came, okay, stop. If it had no side effects, it cannot be a good treatment. Then I said, okay, if you don't want to hear, you don't want to hear. I get the patients that you cannot treat. I get the money, because this is where you can get the egos. I get the money. I have a good life. People are great. I get the hugging. You not. And yeah. And if they are alone with their egos, are happy, it's okay. But a lot of them are thinking about, okay, what is this guy doing? And in a lot of cases, I sent the people, the patients, after the treatment back to the guys who said, you cannot do anything but surgery. And they really go. They go there and tell them, I had no surgery, I can do everything. And there I had 3 or 4 surgeons in my area around that called me. They don't have MBST now, but it's like a, coincidence. They do the surgery, and they know when I send them there, the results of the surgery get better. So they get a little piece of the cake. Yeah, they say, look, the last 20 operations I did in this special case, very severe, got great. Yeah, of course, because the operation was good, but the post-operative treatment was better. And you cannot get everybody to, I want to have MBST, but you have to get them there that they say, yeah, that's a good treatment, and I want my patient to have this. Where they get it doesn't matter. Yeah. And I think this is more the key. And to deal with the ego and not to explain to these guys over hours and hours doesn't matter. Yeah. Yep.
I do think that now we have the science. I think that now we have the science. We've got a better platform to go to them and to present that data to them. I feel it's more tangible. But equally, the case studies that we see, the more we treat, the more it's going to filter through, just as you were saying.
Yeah.
It's a slow filter at the moment, isn't it?
Mm-hmm.
Gradually getting through.
Yeah,
and some that are quite proactive, they'll see it and they'll react.
Yeah.
But we have got the science, and I think,
Yeah, that's.
now's the time.
But I have the experience that sometimes I have a few patients coming from the surgeon to get a second opinion, and I tell them, for example, you have to do surgery, but then come to me, or I tell them, no, surgery is not necessary. I give you some science. I really give them the studies, and say, okay, you don't understand it, I think, but tell it to your surgeon. Go back and tell him that you've been here, and it's like they see the study and say, everybody can do a study. That's not really convincing in the first moment. That's the problem. When they get into a conversation with us, the surgeon to me, and I can say, okay, for this I have 3 or 4 studies that are really good, then it's easier. But only to say there's a study, read it, no surgeon reads the study. Because you can do surgery in no study.
I think maybe, is this on? I think maybe a stepping stone might be not to annoy his ego too much. Let him do his surgery.
Exactly.
Let him do the surgery.
Yeah.
Then see if the patient will come and see us for the MBST,
Yeah.
maybe laser, shockwave, whatever. And then the surgeon will see the speed of recovery over time and time again.
Yeah.
He should then see, bloody hell, you're responding so much faster. Then maybe he might start saying, well, why don't you try the MBST before the surgery? Maybe that's the way around it.
Yeah.
And let him move, schmooze his ego a bit more.
It's perfect because to tell you what, the hamstring thing with Dr. Hermann, he's really a friend of me for years, and he knew what I do, but he was like, I do the surgery, you're doing good things, do it. But after I sent him this video of the dancing queen, it was like, what's that? And then I said, that's your patient after 3 weeks. Then there was about 5 minutes. I think he fell over and came up. And then he really wrote, okay, we have to check all my, all my post-op protocols, all my post-op protocols because of you and your results. And we are doing this next week, really, because he is the chief of this clinic, and what he says has really weight. So all his younger, he has got, I think, 35 surgeons under him, and if he is in the position to change something, if he sees this and says, hey, let's change it, then I think this is the first starting point in my area to get the next surgeons that are coming up, and he's educating, to think a little bit different, because it is so important to think outside the box. And all the surgeons cannot think outside the box. I think that's the biggest problem. We have to cross these narrow-minded borders, and we need the higher surgeons to understand it and to give it to the educated ones and the younger ones. And this is the first step that we go now. It's exactly what you said. Yep.
Just on that, I spoke after Liz put me in touch with the Brighton team doctor, and he was super sceptical. The Brighton Football Club team doctor. Yeah. I think they tried the mobile device, and he said, I didn't feel it added anything to the improvement in the players. I felt their time was get better. I think it was a few years ago. So would you suggest, is it better to approach, or not approach, but try and contact players, athletes direct, rather than, say, trying to contact Brighton Football Club and saying, we have this therapy? Yeah. Is it better to try and go case by case to... It's
difficult to contact them directly. You have to have any contact to them before. You cannot call them and say, hey, we have got cool things because this is happening every day. I think you have to get the managers. What I'm doing, I think in January, I get together a lot of the managers and trainers of the teams in my area that are higher in the 4th league, 3rd league, 2nd league, to get them together, only the managers and the trainers, the coaches, to tell them what is possible. Because I've so often the problem, I talk to a coach or a manager and they say, hey, that's great what you're doing. The manager of these 2 guys said, unbelievable. But the doctors and the teams in the clubs don't want to hear that. So if you get them together and all of them hear the same and they can all talk to each other and say, hey, what, do you do that in your club? And all they say, no, we don't do that. And then they are thinking about, okay, why aren't we doing that? Then they start to send you 1 or 2 players, and then it works, and then you have the foot into the door. And I think this is the only way. They have to see it, they have to feel it, they have to see the faces of the players after, if they stand up after 4 days. I had crutches when I came in. Yeah, and that's the way you have to do it, I think. Information to all the others. You can also do it for the players, but in most of the cases the players are only doing what the manager says. They're not thinking on their own. Johnny is a perfect example that he does it different, but the most of them are only doing what the manager says. Yeah. It's my opinion.
I think also an important thing I had is you need to understand the technique. And normally a football club is borrowing the flexible machine for 2 patients. We had it a lot. And then if it's a manager, the owner, the one guy you met, he brought it in. The physio is not convinced. Yeah.
Yeah.
They choose the 2 players which have an injury, which they have since 40 years and nobody knows to treat. And then they expect the miracle and they don't get it. And and this is the difficult part, you know, that you need to understand it. And we had really a living example. The team doctor of Hamburger SV, now it's second league in Germany, it was a famous Premier League team. He's a very good friend of me from my study times, and he's now professor there. And he got the machine because I said, you have to take it now for the club. So and
that's perfect.
Yeah,
Get a friend of him and say, you have to do that.
Yeah, that's a good friendship. And after 3 months, he was like, okay, we had an expert meeting, and I think he was not really convinced. He only did it because I told him to do it. And then he saw the presentation of Peter and saw the muscle case of Peter. And then he started to understand where he can use it in his patients and talk to his physio. And now he's fully convinced, and he's using it, and he's integrating it. And this shows, you know, the right angle to target is so important, and to get understanding. This is not a technique you can just bring in and run away. And you know, you need to spend the time to think about what it can do to have the maximum effect. And this was one comment we had on your surgeons, and to convince them, you have to create a need, and you can never convince us a product. I think Ian said today, you have to close the gap, and you know, without the gap, you cannot bring in the machine. And you know, I always try to define what gap someone has. Everybody has a gap. So, for example, we have the knee implants, and he was fully against. And if I would tell him about a grade 3 could wait 5 years longer for a knee implant, I could talk until tomorrow. But then, but then I said the outcome of knee implants is still only 2/3 good. And then he said, oh, physio, all these people, they don't do it afterwards, the patients, my surgery is good. And I said, but with MBST, out of the 30% which fail, you make half of it doing well, because the machine is doing the help you wanted to have afterwards. He said, oh, when I have it for every surgery now. And you know, this is important to create needs where they see it can add something to their therapy. And everybody has a need. It's a trick in people, everybody has a need. And to find the need, and then you can convince people to do these things really. And therefore, it's something, it still needs time, you know. It's nothing you can do, but this is, I think, the great work also, to find these needs and then, you know, bring them in.
But how we say in Germany, I translate a little bit, the steady drop makes a hole in the stone. I don't know if this is in England too, but I think that's it. You have to be convinced that you're doing the right things and bring it out with confidence. Because if you see here all the cases, then Matthias will presentate some, we have to be confident that this is really, really a game changer. It's how I think Johnny said it about 12 to 13 times. It's life-changing for a lot of people. And if they understand that, and we have more and more cases, more and more patients that can bring that over, then we win at the end.
I think the natural...
I can understand you.
So going back to football clubs, where there is immediate patients, some of these clubs have the best part of 30 healthcare practitioners on duty. So that's an awful lot of money for the club, but understandably their jobs. These are people's jobs, so they're not going to buy into a product particularly. Quite rightly, without someone like yourself speaking at a conference and them having a deeper understanding of what could be achieved. But accumulatively and beautifully, that would grow. My nervousness as a small practice, where I'm surrounded by lots of London clubs, if those clubs take ownership of a machine and start practicing potentially not in the way that we as healthcare practitioners would apply that treatment and manage it as it should be managed, they would apply it in their snake oil fashion that they feel they might try a bit of this and try a bit of that, but not necessarily look at a cohesive triage of treatments to support the patient, because to them it's just a person that earns the club money. They're not,
that's right.
They're not a patient
You
particularly.
see 2.5 weeks to get him back on the field.
Correct.
And they said what they said to him was, because of the severe MRI findings, 6 to 8 weeks.
And it's not just about giving them ownership. It's very much about the authenticity of what MBST plus ourselves as practitioners
that's it.
are trying to achieve.
Yeah, it's only an add-on.
The minute you give them that product, you have no control over it. So by keeping it in-house, one, you know, we're obviously gaining business, gaining awareness, but predominantly we're constantly creating 100% authenticity of what we believe and are very passionate about.
Yeah, that's it, to bring that over. We had an example, we put it in a club, and they put the guy in and stopped physio. Because now we have this one machine, let's do it. Okay, they didn't understand.
So we have had that. We have had where a surgeon has actually done the stitches too tight, but that has only become very apparent as the swelling. Immediately after surgery, we're treating on MBST. The swelling has gone down, but the recovery is not affording the guy to get back into where we want him to be. And they thought that was down to us.
It doesn't matter.
But it's interesting.
It's good for you. Gives the next hugging.
But he goes back in, gets the stitches removed. He's then back playing, and he's doing much better. But ultimately, it's, as I say, if that journey is taken away from us as clinicians and it stays in-house, you don't ever have transparency of what MBST is truly achieving. Yeah,
I think the most important thing is not the doctor. It's good when the doctor says, okay, that should work. The most important thing is to get the physicians. If the physio says, okay, I put this into my all-day treatment for the professional athletes, then it's in. And then they will see what it brings. But if this is like, put it there, we have a lot of things there, put the player in, and that's not the way. And so I think we have to get the physios, and the managers. Okay.
Lunch.
Great.